Good morning, everyone. For today's topic, group therapy. What is group therapy? Group psychotherapy is a treatment of psychological problems in which two or more patients, clients interact with each other on both an emotional and cognitive level. In the presence of one or more psychotherapists who serve as catalyst, that is the person who can be related to or who can understand the other's point of view, facilitators or interpreters. History of group therapy. Originally found successful in treating patients with tuberculosis in the early 90s. Jacob L. Moreno introduced group therapy in counseling in 1920, later used during World War II for treating those with emotional reactions. In 1946, T groups emerged to enhance interpersonal relationship. It was the beginning of modern group work. Encounter group, intended for normal functioning who wanted to grow. Marathon group, break down barriers that individuals use. The 1960 Human Potential Movement, founded on the belief that the most people only use a small percentage of their capability, but that within a group experiences, they can recognize their full potential. Goals of group therapy: help individuals identify maladaptive behavior, help with emotional difficulties through feedback, offer a supportive environment. Types of group: psychoeducational or guidance group, counseling or interpersonal problem solving groups, psychotherapy groups, task or work groups. Psychoeducational or guidance group. The purpose is to teach group participants who to deal with a potential threat, catching the flu, developmental life events, growing older, or immediate life crisis, death of loved one. Used in educational setting but frequently used in hospital, mental health center, or social service agencies. Counseling or interpersonal problem solving groups. These groups help participants resolve problems of living through interpersonal support and problem solving. Psychotherapy groups. These groups focus on personality reconstruction or remediation of deep-seated psychological problems. Task or work groups. A group that comes together to perform a task that has a concrete goal. For example, community organizations, committees, planning groups, task force. Stages of group development. Forming. Team acquaints and establishes ground rules. Formalities are preserved and members are treated as strangers. Storming. Members start to communicate their feelings but still view themselves as individuals rather than part of the team. They resist control by group leaders and show hostility. Norming. People feel part of the team and realize that they can achieve work if they accept other viewpoints. Performing. The team works in an open and trusting atmosphere where flexibility is the key and hierarchy is of little importance. Adjourning. The team conducts an assessment of the year and implements a plan for transitioning roles and recognizing members' contributions. How we conduct group therapy. Guidelines for group therapy. Maintain confidentiality, commitment to attendance, socializing with group members, putting feelings into words, not actions, role of leader and members. Yalom's therapeutic factors. Yalom, 1995, defined therapeutic factors as the actual mechanism of effecting change in the patient. Yalom identified 11 factors that influence the process of change and recovery among group therapy clients. 11 therapeutic factors. Universality. Feeling of having problems similar to others, not alone. Altruism. Helping and supporting others. Installation of hope. Encouragement that recovery is possible. Guidance. Nurturing support and assistance. Imparting information. Teaching about problem and recovery. Developing social skills. Learning new ways to talk about feelings, observations, and concerns. Interpersonal learning. Finding out about themselves and others form the group. Cohesion. Feeling of belonging to the group, valuing the group. Catharsis. Release of emotional tension. Existential factors. Life and death are realities. Imitative behavior, modeling another's manners and recovery skills. Group compositions. Homogeneous group. Group composed of patients of the same age, race, sex, socioeconomic level, and similar of illness. Heterogeneous group. Group vary on different clients' age, race, sex, socioeconomic level, and different category of illness. Concerns in group work. Group size. Group counseling and psychotherapy generally work best with 6 to 8 members. If group run as long as 6 months, 10 people can be included. Length and duration of sessions. Group sessions range from 1 to 2 hours. Group structure. Open. Allows members to enter and leave the group as needed. Second, closed. Only the group members who started at the beginning are in the group at the end. Purposes of therapy's intervention: to help build an atmosphere of trust and safety, to enforce rules and norms, to provide feedback, to get a member's input, reaction, or feedback, to draw connections between members or point out themes, to correct irrational or faulty thinking, to empower participants, to offer support when needed, to reinforce helpful contributions, to encourage constructive risk taking. Functions of group therapy: sharing experiences, support to and from group member, socialization, immediation, international learning. Sharing experiences. These help the client to realize that they are not isolated and that others also have similar experience and problem. Hearing from other clients that they shared experiences is often more convincing and helpful than reassurance from the therapist. Support to and from group member. The sharing action of being mutually supportive is an aspect of the group cohesiveness that can provide a sense of belonging for client feelings who feel isolated in their everyday lives. Socialization. It is acquisition of social skill. Example, maintaining eye contact within a group through comments that members about one another deficiencies in social skills. These processes can be helped by trying out new ways of interacting within the safety of the group. Imitation. It is learning from observing and adopting the behaviors of other group members. If the group is run well, client imitate the adaptive behaviors of other group members. International learning. It refers to learning about difficulties in relationships by examining the interaction of individuals with the other members of group. Techniques of group therapy. Roles of therapist: an advisor, an advocate, a facilitator, a social policeman, a technician, an enabler. Techniques of group therapy. Cognitive therapy. Focus on irrational thoughts and beliefs of members and restructuring perceptions and beliefs by substitution of new effective thoughts and beliefs. Behavioral therapy. Behavior is learned, so ineffective behavior can be unlearned and replaced by effective behavior. Role play. One member of the group can portray someone in another group member's life to give the other member a chance at practicing how to communicate effectively. Story writing and sharing. Members write a story about themselves and their lives and then read it aloud for the group to hear and discuss. Task-oriented groups. To develop social skills interacting in a group home. Therapeutic activity groups. Wide array of art, music, dance, psychodrama, and many other techniques having a defined therapeutic goal. Areas that may particularly benefit from a group therapy: addiction, anxiety, depression, obsessive compulsive disorder. Benefits of having co-therapists: more expertise, allows for division of labor. For example, one leader can concentrate on content and the other leader can look at process variables. Group members receive more individual attention. Two leaders can model communication and conflict resolution. Two leaders provide diversity in theoretical orientation, interpersonal style, and cultural resources. Limitations, dangers of co-therapist. If two leaders do not get along, it can be detrimental and even harmful to group. Co-leaders might develop competition between themselves and these two is not good for the group. If co-leaders have different skill levels, one might try to lead the other. This can lead to coalitions with other group members or even in the marginalization of the more inexperienced leader. Group members might feel ganged up on if both leaders become adamant in getting across a therapeutic message. Advantages. You realize you're not alone. Facilitates giving and receiving support. Helps you find your voice. Helps you relate to others and yourself in healthier ways. Social skills. Learn from others' mistakes. Diversity of opinions. It costs less. Disadvantages: limited privacy, personality clashing, loss of trust. It strikes fear into some patients. It doesn't guarantee confidentiality, social anxiety, mourning a loss. Conclusion: group therapy plays a major role in rehabilitation of mentally ill clients. It gives an opportunity for immediate feedback. It facilitates chance for therapists to observe the client's emotional and behavioral response towards variety of people. Enhances client's communication, decision making, and assertive skill. Thank you.